What if I told you there's a delivery service that runs 24/7, never, ever takes a holiday, and its network of roads is so vast it could circle the entire Earth twice? Well, this isn't some futuristic sci-fi concept. This incredible system is humming along inside you right now. Today, we're going to pull back the curtain on your body's most essential service, the circulatory system.
To really get a feel for this system, let's start with the little puzzle. Think about a tiny, single cell at the very tip of your big toe. And now, picture a neuron buried deep inside your brain. I mean, they're worlds apart, right? They do completely different jobs. So what on earth could they possibly have in common?
Well, despite all that distance and their totally different functions, they share one absolutely critical need. They are both completely dependent on the exact same non-stop delivery service just to stay alive. And that one shared need, that gets us right to the heart of this system's mission. It's not just important, it is, quite literally, your body's lifeline.
The official medical term for this whole process is perfusion. Now, that sounds super technical, I know, but the idea is actually really simple and kind of beautiful. It's just the constant flow of blood delivering all the good stuff, like oxygen and nutrients, and then hauling away the garbage, like carbon dioxide. This process, this perfusion, is the fundamental reason you're alive and listening to this right now.
So if perfusion is this constant delivery service, what's the engine room? The central command center that's powering the whole operation? Well, that, of course, is the heart.
This thing is just a magnificent four-chambered pump, and it works in this perfect, continuous loop. Okay, so oxygen-poor blood comes into the right atrium, gets pushed to the right ventricle, and then it's sent off to the lungs to get a fresh tank of O2. Then, that fresh, oxygen-rich blood comes back to the left atrium, gets pumped into the super powerful left ventricle, and whoosh, it's shot out through the aorta to the rest of your body. It's this perfect rhythmic cycle, and it does this over 100,000 times a day. Incredible.
But like any massive highway system, things can go wrong. What happens when the highways of this delivery system, your arteries, start running into trouble?
One of the biggest and most common issues is something called hyperlipidemia. Yeah, it's a mouthful, but all it really means is having too many fats or lipids in your blood, and the most famous one is cholesterol. Just imagine your body's super highways getting all jammed up with slow, sticky traffic. That's basically what's going on.
But here's the thing, not all of this traffic is bad. You've got HDL, or high-density lipoprotein. I want you to think of this as the cleanup crew. This is the good cholesterol that actually helps scrub junk out of your arteries. And then you have LDL, or low-density lipoprotein. This is the gunk builder, the bad stuff that loves to stick to your artery walls and cause a whole lot of trouble.
And this is where it gets really dangerous. When you have way too much of that bad LDL cholesterol floating around, it starts to build up and form these hard deposits called plaque. This whole process is known as atherosclerosis, and it narrows your arteries, which chokes off blood flow and creates the absolute perfect storm for a dangerous blood clot to form.
And over time, all that plaque buildup leads to arteriosclerosis. This is where the arteries don't just get narrower, they also get stiff, they lose their stretchiness, the flexible highways you had when you were younger become these rigid, brittle pipes, which makes them even more likely to get blocked up or damaged. Now, when this hardening and narrowing happens in those super important arteries that feed the heart muscle itself, that's what we call coronary artery disease, or CAD. And listen to this isn't some rare thing. It is the #1 killer in the United States. These blockages aren't just for the main arteries either. Sometimes a clot can form way down in a deep vein, usually in the legs. This is called a deep vein thrombosis, or a DVT. Think of it less like a system-wide traffic jam and more like a sudden major pileup that completely blocks off a key side road.
And that's exactly why this side road accident is so incredibly dangerous. A piece of that clot can actually break free, travel all the way up through the heart, and then get lodged in an artery in your lungs. This is a pulmonary embolism, or PE, and it's a life-threatening, full-blown medical emergency.
So blockages are one huge problem. But sometimes the issue isn't a clog at all. It's that the entire delivery system is just operating under way too much stress. The pressure is just too high.
And this is hypertension, which you probably know as high blood pressure. It just means the force of your blood pushing against your artery walls is consistently too strong. It's kind of like running the water pipes in your house at full blast all day, every day. Eventually, that constant strain is going to cause some serious damage.
So we measure this with two numbers. A nice, healthy reading is generally somewhere around 120/80. When that top number, the systolic pressure, is consistently over 120, or the bottom number, the diastolic, is over 80, your blood pressure is considered elevated. Your system is officially under stress. Okay, so clogged arteries, a system under too much pressure, it all might sound a little grim, but here is the really good news. We have a clear strategy for how to fight back. There's a maintenance plan.
For hypertension, the response is usually laid out in steps. Step 1, the foundation, is always diet and lifestyle changes. If that's not quite enough, Step 2 often involves adding a medication, like a diuretic. And if more help is needed, Step 3 brings in other types of antihypertensive drugs to really get things under control.
And what about clearing out those clogged arteries? Well, we've got a powerful toolkit for that too. It always starts with the big three: quit smoking, make some dietary changes, and get moving with exercise. On the medical side, we've got powerful lipid-lowering drugs called statins. And for really bad blockages, surgical procedures like placing a stent can physically pry that artery back open.
So, that's the system, the common problems, and how we fix them. But maybe the most crucial part of all of this is knowing how to spot trouble early. You need to know the warning signs.
A really simple way to remember what to check for, especially in your arms and legs, is the mnemonic PATCHES. P is for pulses, A is for the appearance of the skin, T is for temperature, C is for capillary refill, H is for hardness, E is for edema, which is just a fancy word for swelling, and S is for sensation, things like numbness or tingling. It's a quick check that anyone can learn to do.
So, your circulatory system is so much more than just a chapter in a biology book. It's a 60,000-mile lifeline, delivering exactly what you need to every single part of your body. So I'm going to leave you with one final question to really think about. What's one thing you're going to do today to protect it?